مساء الخير. First of all, I would like to thank you so much for giving me the opportunity to be here and presenting in the presence of the top radiology and women health figures in our region, in Egypt and our region, giving me the chance to present Siemens Healthineers' latest technology and the power of tomosynthesis in Siemens Healthineers in the upcoming 10 minutes. First of all, according to the WHO, MOH, and the presidency website, 30% of the women cancer females are breast cancer. And also we have a high rate of late stage diagnostic of T3, T4, which is including lymph node involvement. One of the main barriers is the awareness, the cost of the scan, the accessibility of the scan itself, scan pain, and dose. Egypt target, we have the presidential campaign which launched in July 2019, the main goal to screen 28 million women nationwide, in addition to have a free clinical breast exam and free treatment. In addition to increase the awareness and to facilitate the scan accessibility. In Siemens, we were honored to be selected as the main vendor for this campaign by providing and delivering 90 units of mammogram to equipped with the normal 2D scanning and also with the tomosynthesis and contrast-enhanced mammogram. In addition, we will be able to support the government to facilitate the scan accessibility across the nationwide. One of the main barriers in the breast cancer screening that approximately 50% of the women getting annual mammogram will have a false positive findings, and also 1 in 8 breast cancers are missed due to the false negatives. According to TOISMA, it was a trial made in Germany using 17 mammogram system from all vendors, scanning approximately 100,000 women in Germany, providing that DBT plus synthetic mammogram increased the invasive breast cancer detection by approximately 48%. In addition, to have a lower recall rate of 2%. You can get more information regarding this paper by scanning the QR code. Now it's time for Siemens to exclude the maybes by providing three unique techniques: platinum tomo, flying focal spot, prima reconstruction algorithm. Our main goal is to maintain the wide-angle DBT design, reduce metal artifacts, improve microcalcification visibility in DBT inside 2D and inside 3D. In addition to implement adjustable parameters in DBT reconstruction pipeline, and also reduce the acquisition time, breast compression time, and improve the ergonomics of the system. Here we can see our unique 50 wide-angle tomosynthesis versus the 15 angle tomosynthesis. We have a clear picture for a greater accuracy and diagnostic confidence. In addition, we have the highest differentiation of the overlapping tissues. Now to the basic theory, where we have the Z, Y, and X axis. The Z resolution, it depends on two main factors: the coverage of the angular range and the number of projection. All Siemens equipment for the tomosynthesis have 50 wide-angle tomosynthesis plus 25 projection. The wide angle and the multiple projection allow us to have a clear, very thin slice with the rich anatomical details. Clinically, higher depth resolution means better separation of the overlapping tissue, improving visibility, shape, structure, and depth. Now moving to the X and Y, which is the in-plane. In order to have the better outcome from the X and Y and in-plane, there is 3 main factors: the magnification, the effective of the focal spot, and the detector quality. Clinically, the better in-plane resolutions mean improved the visualization of the microstructure, clearly differentiation of the calcification within the cluster, and more detailed assessment of the clarification morphology. Traditionally, doing a tomosynthesis, there is 2 ways to do it in the systems. The first one is stop and shot, and the other one is the continuous focal spot movement. snap and shot the tube, accelerate, stops, capture the image, then moves again. This makes the acquisition longer, and with the wide angle, the process becomes very slow. With the continuous movement, the focal spot moves during the exposure, causing a smearing and the movement direction. This increases the effective of the focal spot size. To reduce this effect, we should be slowing the system, and the scan will take approximately 25 seconds. With our new system, the Mohamed P Brilliant, we will be able to provide the new techniques for the tomosynthesis, which is the flying focal spot. How it goes, the tube moves in the right direction, then the focal spot is kept virtually static. Using the electromagnetic pulses, the focal spot is pulled on the opposite direction, compensating for the tube movement, which is delivered two main benefits: a high resolution in the end plane and faster acquisition of the scan. Here we can see, combining the two solutions, the 50 wide angle and the flying focal spot, we will be able to have a shorter scan time and compression with just 5 seconds, and resulting clearly visible findings for a clearer answer with less compression for the patient. And here is a short video showing you how the system is working and how to do the tomosynthesis in just 5 seconds. Here the tube moves 25-degree right and then 25-degree left. While this movement, the system do a 25 projection. Now, with the primary construction algorithm, providing three main elements: the advanced artifacts reduction, adaptive image impression, and domain-specific noise filtering. The element number one, the advanced artifact reduction for high attenuation objectives. Here we can see on the right side, sorry, in the left side, a normal image without using our technology. Now on the left side, we can see that the system has, using the primary construction algorithm, we see the halo and shadow effect is almost totally gone. Also in our synthetic images, we have introduced the artifact reduction, leading to a significant reduced artifacts being caused by highly attenuating objects. Note this as a reduction, is not an elimination. Now to the element number two, adaptive image impression for seamless workflow integration. Through the nonlinear post-processing, we can now offer a different image impression, which is named as flavor, even in tomosynthesis and synthetic 2D, to ensure a seamless transition between vendors and in multi-vendors environment. Element number three, domain-specific noise filtering. We have created a denaturing noising of tomo slices. With a conventional denoising, it was always evident that the denoising had taken place and sometimes appeared artificial. With our Prima technology, we filter out the noise components, allowing excellent clarification, visibility within the slice. In addition, we have, thanks to the domain-specific noise filter, we will be able to get a better visibility of the microclacks in synthetic images. Again, using our 50-degree unique feature, we'll be able to get a synthetic 2D images generated from the tomosynthesis. This can be replaced, the FFDM, using our AI. In addition, having a 3D reconstruction algorithm, this allows a superficial visualization of the microcalcification and the clarifying its distribution. Last but not least, using our unique techniques of the 50-angle tomosynthesis, we'll be able to have a highest depth resolution, benefits from the precise one-click biopsy targeting with an accuracy of just 1 millimeter. A quick impression of the first sight. The pinpoint accuracy is targeting for diagnostic confidence, precise control, and faster biopsy procedures. Thank you again. And please, if you have any question, I'll be there in the conference. Thank you.
Thank you
شكرا
for
لحضرتك.
this presentation. Any questions?